Hizi ni dalili zote za hatari kwa mama mjamzito na mtoto wake. Tuzime kwa pamoja, tukumbuke mwaka kichwa nijue kuna mama yoyote ambaye ameshawahi kutumia kile kifaa cha kumpa pumzi, ile tulikuwa tunafanya 1 2 3 pumzi. Kuna mama yoyote ambaye ameshawahi kutumia kile?
Nilitumia kwa yule mtoto wa miaka 2 aliyesinya hapo nyumbani. Nikamsaidia ikawa nimepumua, nikampeleka hospitalini.
Okay, so mama just think that she get a 2 years old treatment. You remember that story? And they applied it and it helped. Mtu mwingine anayetumia?
Sitapata changamoto nayo tu mbaya, sitapata changamoto.
Lakini wote sasa hivi tumekumbushia ule ujuzi wa kutumia. Ndio? Je, kuna mtu yote amekisafisha? Aliwahi kujaribu mwenyewe kukisafisha kile kifaa? Je, kuna mtu yote ambaye anafikiria kwamba anaogopaga kukifungua na kukifunga, labda ni ngumu sana, nitachanganya? Kuna mtu yote ameshakuwa na hisia namna hiyo? Kama pengine kufungua, mama karibu.
Sisi ni vijana ndio tumeanza, kwa sababu tunajua kufungua.
Okay. So some of them will say that they get tested sometimes, but with the skills that we have just reviewed yesterday, they are now good.
Good, that's great. Okay, so we're going to do it again.
Yes. Tutaenda tuna kulifanya hilo zoezi leo. Sawa?
Sawa.
Na usijaa ya kuendelea na hii kazi, ile mtoto ambaye ametoka akawa mkono ameenda hivi na kusokotea na nini na kitofu. Kwa hiyo ameniongezea kwa sababu nimejua jinsi ya kufanya hivi na kufanya hivi, mkono inatoka wakati anatoka nashika tena hivi, bega lingine linatoka, alafu nasokota kutoa na initolea. Ndio kitu ambaye kabisa kwa vyote yote ni mazuri, lakini kwangu hiyo ni nzuri sana.
Sasa yeye kwake amejifunza kwamba ile ya mkono umekwama, lakini wakati huo bado kitovu kimezunguka nini, yeye anaona ile alivyojifunza namna kutoa kwake ni mafanikio makubwa. Hicho ndio kitu ambacho nataka. Nataka kila mmoja aseme kitu ambacho yeye, pamoja na kama watu wengine wote wamesaidika, lakini yeye kama yeye, sawa, au wewe kama wewe umesaidika zaidi. Asante sana mama. Nani mwingine? Kufanya sawa, using'ang'anie kitu ambacho fanyaje. Tumekubaliana, tazama, kama ulikupapasa tumbo ni kufanyaje, ukishajua hii huwezi peleka wapi? Sisi ni mashujaa, lakini tusijifanye mashujaa, sawa? Kuwa shujaa pale ambapo unahisi hapa naweza kufanyaje, lakini kama unajua kabisa huwezi, shujaa wa kwanza mzuri ni yule anayeweza kujua vita anayoiweza, sawa? Usipigane vita usiofanyaje. Medema la habala mindimu. Ndio hiyo. Tayele ndoge nindim, bana mindim. Nemi mute biyelo. Kasi tayelo ni asa nindim, wala mindim minda soyai.
I'm Dr. Benjamin Charles from Machame Hospital. I'm also the head of obstetric and gynecology department. So I would like to thank Paneta together with their partners called Rotary International from Canada for the concern on the obstetric issues, particularly the leading cause of maternal death in Tanzania, which is postpartum hemorrhage. As we know that postpartum hemorrhage is one of the cause of maternal death, particularly in Tanzania, and of course the introduction of this knowledge of use of one of the life-saving garments called non-pneumatic anti-shock garment is going to save the life of the number of maternal, eradicate or reduce the number of maternal deaths, particularly here in Tanzania. So finally, we are going to be the champions of the use of the life-saving garments. As I mentioned, it's called non-pneumatic anti-shock garment. And finally, I recommend that this program should be extended in different parts of the Tanzania, so that they can going to help to reduce the number of deaths if it's going to properly use. I'm Dr. Benjamin Charles from Machame Hospital, and I'm also the head of obstetrics and gynecology. I would like to thank Paneta together with their partners Rotary International from Canada for their concern on obstetric issues, particularly on the management of postpartum hemorrhage. As we know, the postpartum hemorrhage is one of the leading cause of maternal death, particularly in Tanzania. So, as this program concerned with the management of the condition, as I said, which involved the use of the one of the involved kit called a garment called non-pneumatic anti-shock garment. As a global agenda of WHO of reducing maternal death to zero, so this program is going to reduce the number of maternal deaths, particularly in Tanzania. We are going to be the champions of the use of this new kit called or garment called non-pneumatic anti-shock garment. I do recommend this program should be extended to different parts of the country, particularly from primary health facilities, and also the tertiary level should be involved.
Kwa majina naitwa Catherine Moshi, ni afisa muuguzi, nafanya kazi hospitali ya wilaya ya Sia, pia ni mratibu afya ya uzazi na mtoto ndani ya wilaya ya Sia. Kipekee sana ni washukuru sana wadau wa Rotary International pamoja na Paneta kwa mafunzo mazuri yaliyofanyika kwa watumishi, hasa kwa lengo la kupunguza vifo vinavyotokana na wamama wengi kutoka damu baada ya kujifungua. Kipekee sana mafunzo haya yataleta matunda mema na vifo vingi vitapungua ndani ya Sia na ndani ya Tanzania. Kwa hiyo kipekee ni waombe sana wadau Rotary International pamoja na Paneta waweze kuongeza kwa maeneo mengine zaidi kwa lengo la kupunguza vifo vitokanavyo na afya ya uzazi na mtoto. Niwashukuru sana, na mafunzo haya niombe yawe endelevu ili watu wengi watumishi wapate elimu kila wakati na kuboresha huduma kwa mama na watoto.
I'm Dr. Bernard John Ntaremwa. I'm from the Peri-Urban Ambulatory Nexus Tanzania Paneta organization. I am the director of human resource management, and I have also been working as a technical team member for the organization for the past 2 weeks, where I have also been one of the trainers in the maternal VTT for the year 2024. First of all, I would like to thank the individuals and the organizations which has contributed so much to make this event and this training very successful. To start with the organizers, it's very important to talk about Andrea Cassidy from Canada, but also to talk about Richard Caron and Michelle White. These have been working so much from Canada, doing some contributions, collecting some contributions from various Rotary clubs and the various individuals to collect a lot of money to make sure that we come here in Tanzania and we do training to first of all, the traditional birth attendants and the healthcare providers to teach them about management of patients who happen to bleed too much after birth, to teach them on how to help babies who happen to be delivered and they are not breathing, but again to teach them about the newly diagnosed or the newly invented device which is called the non-pneumatic anti-shock garment. That is an added advantage to the management of postpartum hemorrhage. This device is really a very important device because what it does, it prevents people who are bleeding too much from getting into shock, and then prevents shock and therefore buying much time for them to be transported to the higher facilities so that they could get definitive management of the hemorrhage. So we are very grateful that we had a lot, more than 100 devices, NASGs, which have been distributed to all facilities, all dispensaries, health centers, and even the Siha District Hospital, and of other facilities which are either government and non-government facilities from the Siha District. We also distributed these NASGs to other facilities. Apart from Siha District Hospital or Siha District facilities. For example, the Machame Lutheran Hospital, High District Hospital. Again, we had some referral hospitals and tertiary facilities which received the donation of the NASGs, which include Mawenzi Regional Referral Hospital and also Kilimanjaro Christian Medical Center Hospital, which is a tertiary hospital in the zone, in the northern zone of Tanzania. So we are hoping that these NASGs are going to play a substantial role in the management of postpartum hemorrhage, and it is going to reduce the number of maternal deaths that are happening now because of hemorrhages, but also we hope that it is going to reduce the number of emergency hysterectomies. Some of the mothers do end up losing their uteruses because of hemorrhages. Once it happens that she's bleeding and you have no way out, usually you need to get out the uterus so that somebody can be saved. But now with the new invention of the non-pneumatic and shock garment, we are hoping that we are going to save these uteruses. But also, it's going to reduce the number of blood transfusions. Remember, we have a very big burden of blood transfusions. We don't have enough blood. The blood cannot be made anywhere. The blood has to be donated by somebody for someone who is sick to be transfused. So with the non-pneumatic and shock garment that reduces the amount of blood loss, that means if the patient was supposed to receive maybe 4 units of blood, now she's going to receive maybe 2 or 1 or none. So we are very grateful for all the individuals, for all the clubs, especially the Rotary clubs, and the Rotary International and the Rotary Foundation as a whole, but also the team from Canada. It was led by Andrea Cassidy, was a team leader, Michelle White, but also there were 2 midwives who have been here teaching and training traditional birth attendants and healthcare providers on these aspects of bleeding after birth, essential newborn care, and also non-pneumatic and shock garment use. So we thank them, and the 2 have been Tess and Andrea Robertson. So we thank them too much. But again, I wish to thank the Paneta team as a whole. We have been very cooperating with the maternal VTT team from Canada to ensure that the knowledge that we have and the skills that we have, we transfuse them to these traditional birth attendants and healthcare providers, especially from the facilities that we have been teaching. We are hoping that if these skills are going to be used effectively by the healthcare providers in their facilities, the number of maternal deaths and the other complications are going to be minimal or will not be present at all. Now the only thing we are committing ourselves to is about positivity. We are going to make sure that we do a lot of follow-ups to the facilities where we have donated these NASGs to make sure the standards, the skills that we gave them are the ones which they are correctly followed during the application and the usage of these NASGs and other devices that we donated. So with that, I wish to thank everyone who has been here, and I'm grateful that the training was so successful from the feedbacks that we got from the healthcare providers and even the traditional birth attendants. Thank you very much.
My name is Dr. Lecton Morris. I'm the Director General for Peri-Urban Ambulatory Nexus, Tanzania. We thank God that we have had a wonderful 2 weeks here in Moshi, having training to different healthcare providers and traditional birth attendants all over from the Siha district in Kilimanjaro, trying to share the skills on the important ways of saving mothers and babies who are dying out from obstetric hemorrhages. We've been here training people how to properly apply and remove non-pneumatic and short garments. We thank our partners, Rotary International, the Rotary Club of Windsor, and our local host club, the Rotary Club of High, for such a generous host and for such a generous cooperation they gave it to us. We appreciate all the support. We appreciate even all the healthcare providers who came here and be with us for the past 2 weeks when we're trying to share these important skills just to make sure that no mother and no baby that lost their life just because of causes that are prevented. This wonderful job is because of the contribution from different partners, and because of that, we are fully committed to do different activities post this project. Number one, we will go and oversee the proper application of NSG to make sure that these trainees are properly applying these non-pneumatic and short garments, and they should apply according to the memorandum of understanding. We agreed that it should be free of charge. We will be going there and do different retraining sessions, and we will go there and make proper supervisions just to make sure that this skill has been distributed equally to all the facilities and to all other healthcare providers who have not managed to come to the training. But we'll be going there and make sure that we have strengthened the methodologies of collecting data and analyzing them. We'll be going there and get up a lot of follow-up, a lot of feedback, and just make sure that this project is working as we agreed and according to the objectives. And again, we will make sure that these NSGs are not going just to be stored. We will try to make different visits to make sure that they are all being used, they are all being properly cleaned and folded and being stored into the places that they have to be. But again, we want to make sure that the traditional birth attendants that we train here, we'll go and see how they're practicing. We're going to see if they're really using the supplies that we gave them. We have gave them a lot of birth kits that they should go and use to assist the mothers that are having home deliveries to make sure that there's control of infection and the successful deliveries, just to make sure that nobody lost their life. And saying that, we would love sincerely to thank all of our partners who have done this wonderful job to be well succeeded. Starting, I would love to thank the Rotary International for accepting being our partner since last year. And I appreciate the Rotary Club of Windsor, and we thank the Rotary Club of High for accepting to be our local host club. Specifically, I would love to thank our very committed and passionate team leader of this project, Andrea Casti from Canada, for such an amazing job that she has been doing since last year. We would love to thank Michelle White for such a commitment she has. She came here and she done a lot, and the whole team that came here, Andrea Robertson, Tess, and all other, without forgetting Rick Carroll, who have always been a champion of this project since last year. We don't have him here, but we have him in our team, in our hearts. I would sincerely want to thank my team, Paneta team, For every one of them be committed individually. They have left their jobs, they come here to be committed for the full 2 weeks. Special thanks should also go to our local Rotary Club that hosted us here. Thanks to Timothy Masawi, who have always been here on behalf of this Rotary Club. Their cooperation was amazing, and we thank you so much. Without forgetting that sincerely, we have had a very good cooperation from the government officials and authorities, starting from the district, Siha district, coming to the regional level, luckily, and we also had the attendance of the Zonal Reproductive and Child Health Coordinator from the northern part of Tanzania. She attended in this training. She's aware of this training. She also committed about this very important initiative of using non-pneumatic and shock garment as one of the methodologies and the therapies of managing PPH to these mothers to stop them from dying from preventable causes. Saying so, thank you very much everyone, and may God bless you.
My name is Hilary Francis Nengaso. I'm a radiology technologist and district radiology coordinator from Siha District Council. I want to express my heartfelt thanksgiving to the Paneta and the Rotary International Club from Canada, especially Miss Rita Rempure, for the kindness and donation for the mind ray ultrasound machine to our district hospital. This machine has revolutionized the diagnostic capabilities of our hospital. Since the donation of the machine, we have do examination to almost over 800 women. Rotary Club from Canada, from following up the progress of the machine. We had challenge. The software of the machine had a problem. We had to replace the hard drive. So the Rotary Canada team helped us with the new hard drive for replacement of the machine. All in all, I want to give thanks to Paneta and the whole team for making this dream of having a modern mind ray ultrasound machine to our hospital. I would like also to say that this donation of the mind ray ultrasound machine not to end only at our hospital. We want different places, especially from remote areas, to also be donated with the such of equipment to help people also from those areas, especially pregnant women from rural areas, to also benefit from the high-tech machine.
My name is Dorcas Dixon. I am a doctor, and I got a chance to get a short course of ultrasound thanks to Rotary. I have been a contact person for the ultrasound machine that was donated at Siha District Hospital, and I have been making physical visits as well as having Zoom meetings with the radiologist from Siha, and it has been doing great work. It has been doing a very impactful job to the women from Siha District. Most women have benefited from this. Most women have had better outcomes that maybe without the high technology ultrasound that was donated to Siha District, it would not have been possible. I am committed to keep making follow-up and physical visits at Siha District Hospital to make sure everything is working smoothly, from the machine and making appointments with the radiologist Hilary from Siha District Hospital to make sure the machine is used correctly, and most of the job done is the intended job. So I would like to thank everyone, especially the Rotary clubs that have participated to making sure we are getting the machine. Most importantly, Rita, everything is working smoothly, and because of you, you have changed a lot of lives of women at Siha District Hospital. Thank you.
Hi, I'm Andrea Cassidy and I come from Windsor, Ontario, Canada.
I'm Michelle White and I also come from Belle River, Ontario, Canada.
I'm Tess Walter and I come from Ottawa, Ontario, Canada.
I'm Andrea Robertson and I come from Appleton, Newfoundland, Canada.
And we are so very grateful for all the kindness and wonderful experience we've had coming to Tanzania. We have come based on a Rotary Foundation grant. So we really would like to say that we are very grateful to Rotary to see that the world is one place and that mothers and babies everywhere in this world deserve help and good health care. And we're all experienced in our lives. You see the gray hair. So we bring our wisdom and our knowledge to share, and we have loved our time here. Yeah, we're very grateful.